Hi there, my name is Todd Hurst. I am a cardiologist who specializes in the prevention of heart disease. Welcome to Your Health Questions Answered. Millions of people take the medications called statins. Some think too many people are taking these medications, and some think too few. In this video, I will explain what statin medications are, and more importantly, explain why anyone, particularly you, would take a statin medication. Before we get started, I will emphasize that this information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. The official name of statins is HMG-CoA reductase inhibitors, but since that is quite the mouthful, they have become commonly known as statins because their generic names all end in statin. Currently, there are 7 statin medications approved by the FDA in the United States. The over-the-counter supplement called red yeast rice also is a statin, similar to lovastatin. Although I generally do not recommend red yeast rice to my patients as statin alternative because of the lack of regulation of the industry and the accumulating evidence that some of these supplements do not contain what is listed on the label. Here are some statin facts. Statins work by blocking cholesterol production in the liver. The first commercial statin was lovastatin and was released in 1987, so we have over 30 years of experience with these medications. Statins are one of the most prescribed medications with millions of people taking statins worldwide. And although it's generally thought that all of the statins have similar benefits, there are differences in their strength or how powerful they are in lowering cholesterol, as well as how they are metabolized and how long-acting they are. And currently, all statins are generic except for pitavastatin, so are relatively inexpensive. So why are millions of people taking statin medications? Simply stated, people take statins because they lower the risk of heart attack, stroke, and death in those who are at high risk for heart disease. This has been proven in dozens of large, well-designed research studies and is considered well-established by all of the guidelines for clinical practice and the vast majority of doctors and other health experts. One important point that I make to my patients is that the benefit of statin medications is independent of the baseline cholesterol. What this means is that although we commonly refer to statins as cholesterol meds, because they lower cholesterol, it may be more appropriate to call them risk meds because they lower the risk of heart disease even in those with normal or even better than normal cholesterol levels. If you're trying to decide if taking a statin would be right for you, download my free guide, Should You Take a Statin? This gives a balanced view of the risks and benefits of taking statin medications so that you can make the right decision for your goals. There's a link below this video. So now you know why we call these medications statins, and that while all 7 statins are slightly different, they have similar benefit, which is they lower the risk of heart attack, stroke, and death. And while we call these medications cholesterol medicines, maybe the better term would be risk medications because they lower the risk of heart disease. So talk to your doctor about your risk for heart disease and stroke and if a statin medication would be right for you. Thanks for watching. If you like this video, hit the like button below, share it with your friends and family, and be sure to subscribe. I would love to connect with you on Facebook, Twitter, Pinterest, or Instagram, and you can join my Better Health community at toddhurstmd.com, where we talk about your better health, better life, and better weight loss.